let's talk about a body part that sparks endless debate, ancient rituals, modern medicine, and more than a few awkward locker room conversations. With or without foreskin? It's a question that's lingered for generations. And it's not just about looks or tradition anymore. Today, this conversation cuts deeper into science, personal autonomy, and real medical data. Welcome to a world where you're not just told what to do with your body, you get to understand it. Because here's the truth. There isn't one right answer for every man. There's only your answer. And my goal? It's not to push aside. It's to lay out clear, evidence-based facts so you can make a fully informed decision, rooted in your health, your values, and your future. In this video, we'll break down what the foreskin actually does, the real peer-reviewed medical benefits of circumcision, the potential risks and drawbacks, and when circumcision moves from optional to medically necessary. Let's start at the foundation. The foreskin, medically called the prepuce, is more than just extra skin. It's a retractable sleeve that naturally covers and protects the head of the penis, known as the glans. At birth, this skin is fused to the glans and typically becomes retractable during childhood or early adolescence. Now here's what matters. The foreskin isn't just sitting there doing nothing. It has actual biological functions. Function 1, protection. It acts like a natural sheath, shielding one of the most sensitive parts of the body from friction, injury, and environmental irritants. Function 2, lubrication. The inner surface helps maintain moisture and a balanced environment around the glands, which adds to comfort, especially during sex. Function 3, sensation. It contains thousands of fine touch nerve endings, contributing to sexual arousal and pleasure for many men. Function 3, sensation. It contains thousands of fine touch nerve endings, contributing to sexual arousal and pleasure for many men. But despite these functions, circumcision, the surgical removal of the foreskin, has existed for thousands of years and is often now framed as a medical choice rather than just a cultural or religious one. So let's take a hard look at the proven medical benefits. Benefit 1, improved hygiene. A circumcised penis is typically easier to clean. Without the foreskin, there's less chance for a buildup of smegma, that thick white substance made of dead skin cells and oils. Now, smegma itself isn't harmful, but if hygiene slips, it can lead to odor, irritation, and infections. Benefit 2, lower risk of infections. The area beneath the foreskin can trap warmth, moisture, and bacteria, a perfect storm for infections like balanoposthitis, which is inflammation of both the foreskin and glands. Circumcision, especially in infancy, significantly lowers the risk of urinary tract infections in the first year of life, a benefit backed by numerous pediatric studies. Benefit 3, reduced risk of sexually transmitted infections. Here's where science gets loud. Multiple large-scale randomized controlled trials, including landmark studies published in The Lancet, found that circumcision reduces the risk of heterosexual HIV transmission by up to 60%. Yes, 60%, and that's not all. Circumcision also lowers the chances of contracting high-risk strains of HPV, which can lead to genital warts and even certain cancers, and herpes simplex virus type 2, the cause of genital herpes. Why does it help? The inner foreskin is thin, moist, and rich in Langerhans cells, immune cells that HIV and other viruses target to gain entry. Removing that tissue removes a vulnerable entry point. But let's be crystal clear here. Circumcision lowers risk. It doesn't eliminate it. Condoms still remain the best frontline defense against STIs. Benefit 4, lowered risk of penile cancer. While penile cancer is rare, it's often linked to chronic inflammation, poor hygiene, and persistent HPV infection, all of which circumcision helps reduce. But like any medical procedure, circumcision isn't one-sided. There are real risks and real downsides, especially when done outside of proper clinical settings. Let's walk through those now. First, surgical complications. Though rare when performed by trained professionals, circumcision, like any surgery, comes with potential issues. Pain, especially during the healing period, bleeding or infection at the incision site, cosmetic concerns if too much or too little skin is removed. In some cases, revision surgery may be needed to fix problems with healing or appearance. Then there's the most debated topic, sensation. The foreskin is densely packed with nerve endings. Removing it does change the sensory profile of the penis. As time passes, the exposed glands, now no longer shielded, tends to undergo a natural process called keratinization. It becomes slightly thicker and less sensitive to fine touch. Some men say they notice no difference. Others say it decreases their pleasure during sex. It's a subjective outcome, and that's important. What one man feels deeply, another might not feel at all. But there's no doubt, something is removed permanently, and the sensory experience is altered. You also lose the natural lubrication and protection the foreskin offers, which some men value for both comfort and arousal. So it's not about scare tactics, it's about honest, full-spectrum understanding. Now let's talk about when circumcision moves beyond choice and into necessity. There are certain medical situations where circumcision is no longer a preference. It becomes essential. The most common one? Phimosis. This is when the foreskin is too tight to retract over the glands. Mild cases can sometimes be managed with creams or stretching exercises. But in more severe cases, it can lead to pain, chronic infections, hygiene problems, or even painful erections. Then there's paraphimosis. This happens when the foreskin is retracted and then gets stuck behind the glands, cutting off blood flow. That's a medical emergency requiring immediate treatment. And finally, chronic infections. If a man has repeated infections that don't improve with proper hygiene or medication, circumcision might be recommended to prevent long-term damage. Outside of those scenarios, the choice remains personal. It could come down to your cultural background, health beliefs, sexual experiences, or simple comfort. So let's summarize. The foreskin serves real biological roles: protection, sensation, and moisture. Removing it through circumcision offers clear, evidence-backed health benefits, especially in hygiene and reduced infection risks. But it also comes with irreversible changes, possible complications, and a loss of natural tissue. There's no universal right decision here, only the right decision for you. If you're dealing with discomfort, tightness, repeated infections, or just uncertainty, speak to a urologist. A simple consultation and physical exam could help you make a clear, confident decision. And if you're watching this because you care about your sexual health overall, not just circumcision, but things like performance, sensitivity, or long-term function, check the pinned comment. There's a free video linked there showing a natural, science-backed method to restore blood flow and performance without pills, pumps, or surgeries. If this helped you, hit that like button, subscribe for more straight-up men's health videos, and share this with someone who needs real answers. I'm Dr. Jems Wisdom. Take care of your body. It's the only one you get.